Hello, I'm Sarah Young, nursery nurse with the health visiting team for South Warwickshire Foundation Trust. The next few minutes I'm going to be talking to you about introducing solid foods to your little one. It's a really exciting journey, but it can be confusing and there's lots of advice out there. The advice that I'm going to be giving you is the NHS guidelines, best start for life, first steps nutrition, and it's all evidence-based. I'm just going to share my PowerPoint with you and hopefully you're able to see this. Okay, so this is all about introducing solid foods to your little one. Okay, so when do you introduce solid foods? When is your baby ready? Well, there's no need to rush. The NHS guidelines recommend 6 months is about the right time to start introducing solid foods to your little one. Milk is the main priority up until 6 months of age, whether that's human milk or formula milk. After 6 months, milk is still really important, but food now plays a part in the diet. And when do you know whether baby is ready or not? Developmentally, you would like your baby to be able to sit up straight, to hold their head in line so that they can sit steady in a high chair. They should be able to coordinate their hands, eyes and mouth, being able to pick up the food and take it to the mouth. You'll see this during play when they're able to sit on their play mat and pick up a toy and mouth that toy. That's all part of developmental readiness. At 6 months, the tongue can also move more effectively around the mouth. Before 6 months, the tongue can only go back and forth, whereas after 6 months, the tongue can go around the mouth, moving that food around the mouth. They're less likely to push the food out, and it means they're able to chew and swallow better. Okay, so 3 signs that are often mistaken for my baby's ready is chewing the fists and putting their finger to the back of their teeth. This is often because they've got teeth coming. Anything between 3 months and 6 months, you'll see the gums start to change shape. They'll become white and hardened. And this is often a sign of teething. So chewing the fist isn't because they're hungry, it's because their teeth are starting to bother them. They may start waking a little bit more in the night, and often this is because they are having a growth spurt and the sleep patterns do tend to change around 5 months. And they may be wanting extra feeds of milk, in which case increase those feeds of breastfeeding or formula. Remember to feed responsively, and we have all the presentations about responsive feeding under the South Warwickshire Foundation Trust Breast Infant Feeding team. This is often a sign that they are having a growth spurt and not necessarily that they're ready for their solid foods. Okay, so what do you need before you start? You don't need loads of fancy, expensive equipment. We really recommend a cup, 2-handled cup with a free-flowing spout, not a valve that they've got to suck. Your baby knows how to suck now and needs a cup where they can pick it up and drink that water from. They know how to suck. The drinking from a cup will develop their lips so that they will help with their speech development and their teeth as well. We recommend a high chair so that they can self-feed and have finger foods on their tray. It isn't very nice if they're in a bouncy chair or car seat, their spine is curved, and that's not very nice. If you imagine eating your dinner with your chin on your chest, it's not a pleasant experience. Bowls and spoons, but watch for your baby's cues. And they need you. Meal times is a really ideal opportunity for interaction and social eating, and they will be watching everything you do, they are learning from you, watching you constantly. Going back to the spoons, we'd recommend the plastic soft spoons rather than metal spoons, again because those teeth and those gums might be a little bit sore. And it is going to get messy, so we would recommend a mat underneath your high chair. An old shower curtain, cheap shower curtain would do the job, just to protect your carpets. Okay, so milk, as I said previously, is really important. It gives your baby all the nutritional needs. The World Health The World Health Organization recommends exclusive breastfeeding for the first 6 months of life, an introduction to solid foods at 6 months together with the breastfeeding. Full fat cow's milk is recommended from 6 months in their food, but not as a drink. So if they're having mashed potato or custard, or they're having half a Weetabix, you can use full fat cow's milk from 6 months, not before 6 months, but from 6 months. Please wait until they are 12 months before giving it to them as a drink. And your baby only needs the first stage formula milk and not the follow-on milks or stage 2 or 3. This is the manufacturer employ to do with the International Code of Conduct. We are bombarded with advertising, and manufacturers just want to make money. Your baby does not need the stage 2 or any other form follow-on milks. As baby's appetite increases for solid food, you'll notice that the milk will naturally reduce the milk itself. So if you're giving a 200 milliliter bottle, you might find babies only have taken 150. That's absolutely fine. Take the part of the milk the baby doesn't want and never force baby to finish off that bottle. Okay, so let's get started. Stay with your baby and observe for any allergies, which we will discuss later in the presentation. Go at your baby's pace. Some babies will take to this really quickly, others might need a little bit of time. And don't worry if they don't eat too much. At the beginning, it's all about tastes and experiencing new textures. Choose a time that suits you and your baby. If morning time is really chaotic, you've got siblings to get to school, maybe that's not the best time to start. Start at a time when just you and baby, maybe at lunchtime, I've got a nice relaxed half an hour just to start, and so it's a pleasant experience. And try and eat together to encourage good eating habits, encourage different textures to encourage chewing, and don't be put off if baby rejects the food. It could take at least 20 times before your baby accepts that particular food. And allow them the time to explore. And that's not just with their tasting, they can touch, they can smell it, they can lick it, they can taste it, using all those senses to discover the new food that you've given to them. Okay, my baby doesn't seem interested in food or won't tolerate lumps. This is normal. Your baby has only ever had milk, so this is very unusual for baby. And gagging is a very common, normal thing for babies to do. Please try not to be anxious about it, although obviously lots of parents do get worried that their baby will choke. We will come on to this later in the presentation. Some babies like to start with mashed, lumpy or finger foods. If your baby struggles with different textures, process gradually onto the thicker purees, then mash consistently with the soft lumps. Previously, when we were introducing solid foods earlier, we would have to puree all our foods. Now that we are starting at 6 months, we can go straight on to mash and finger foods, soft finger foods. Soft finger foods give the baby opportunity to become involved in their meal time and become familiar with the different foods through their touch, sight, smell, and discover how they can self-feed. Start with home cooked foods from the beginning, as homemade foods are naturally various in texture, taste and flavours. And you know what is in the homemade food. If this persists, here's some ideas to try. Encourage messy play. Let your baby get their hands into the food. Jelly play, baked bean play, all of those foods that they can touch and taste. Encourage them to self-feed, so they've got some food on their tray they can touch and taste and lick and smell. Mouthing toys also allows your baby experience of different textures and sensations without the pressure of the swallowing, and keep it nice and fun. Increase the consistency of food slowly, as it's not a massive jump to go straight onto lumps. Go at your baby's pace. Try placing a spoon with food onto the side of your baby's mouth. This will encourage the tongue to move around the mouth and encourage chewing. Okay, shop bought products. In the UK, we are targeted by advertising around baby products, including shop bought and ready-made meals. A survey by the Dental Health Association of 109 pouches aimed at children under 12 months found more than a quarter contained more sugar by volume than Coca-Cola. Infants sucking directly from the pouches means the food spends more time on the teeth and increases the risk of tooth erosion and decay, not to mention the expense. So summarising this sheet, the shop bought products are often full of preservatives to keep a long date life on this shelf, and those preservatives are usually sugar. So even a savoury dish such as shepherd's pie may be topped up with sugary apple juice just to keep the product on the shelf longer. And it's a really expensive way of doing it as well. Real food that you guys are eating is okay for your baby and a lot cheaper. Your baby will make funny faces when they're eating. This doesn't mean that they don't like it. It's all new. Okay, so at 6 months, we're about to start. We would recommend starting with your vegetables, your root vegetables first. Start with your savoury foods first. This goes back to evolution. When we were cavemen and women and foraging for our own food, we would eat something savoury and it would usually harm us. So we would go for the sweet things. That's where the saying born with a sweet tooth comes from. By starting with sweet foods, this can create fussy eating in the future. So let's start with the savoury foods, let them accept that before we introduce the sweeter foods such as vegetable. Variety is key and gradually increase the amount and offer foods from all the food groups. So starting with the vegetables, then moving on to your fruits, then you can move on to the other food groups. This is a pictorial picture of the food groups that are out there. So you've got your vegetables, you've got your starchy foods, your eggs and pulses and meats, your dairy products or alternative dairy products. Your baby from 6 months can have everything that you eat. There are a limited amount of foods that they can't eat, which we will come on to on one of the further slides in this presentation. Start with your root vegetables, then increase it very slowly. So you may have, for example, carrots the first time, then the next time carrots with a little bit of broccoli, then move on to have a little bit of mashed potato with your carrots and broccoli. And then you could slowly introduce some cheese into that mashed potato, and then you could slowly introduce some fish or some meat. And obviously they can have full fat cow's milk in that mashed potato as well. So that's introducing your dairy. We will discuss vegan and vegetarian options later on as well. Okay, so now your baby is 7 to 9 months, they should have moved on and be enjoying 3 meals a day. Okay, so that's a breakfast, a lunch and a dinner. And keep increasing the amounts and variety of food they eat and go at your baby's pace. Every family is different, so you might prefer to have a snack around midday and have a bigger dinner at night, or you might prefer to have a bigger dinner in the middle of the day and just have a little snack before bedtime. That's entirely up to your family and how your family works. And remember to go at your baby's pace. Your baby will gag. This is really normal. It's how they're learning to manage what's in their food, what's in their mouth, and to learn how to chew and swallow successfully. Okay, now your baby's 10 months, between 10 and 12 months, your baby will be on 3 meals a day, and they may be having puddings such as some fruit and yogurt, and snacks may be considered between meals. Don't give up. It takes lots of time when you're introducing a new food. At 10 months, between 10 and 12 months, you will be invited for a developmental review with your health visiting team, and you can check in to see how little one's doing and take some advice from the health visitor or nursery nurse who is leading the assessment for any advice at this point. Okay, so now your baby is 12 months. You can now introduce full fat cow's milk into their diet. They can have it in a little cup, maybe mid-morning or mid-afternoon, and you'll have noticed that the breastfeeding and the formula may have started to reduce itself. That is really quite common. So full fat cow's milk is recommended until they're 2 because of the iron content. Once they're 2, it can be changed into semi-skimmed. Breastfeeding can continue for as long as you may wish. And if you haven't introduced snacks, now's the time that you can do this. We want to be starting introducing our cup a little bit more and starting to reduce the amount of bottles that we are having and replacing with a cup. Okay, so finger foods, your baby loves picking up foods, exploring it with all their senses and picking it up and eating it themselves. This helps with their hand-eye coordination and they learn to chew and swallow. Let them get messy and explore the food. Be a good role model and eat with them because they will be copying you. One piece of advice that we do give is to wait for cleaning up to be at the end of the mealtime. If we're constantly wiping their hands with wet wipes and wiping the tray with wet wipes, then that food then smells and tastes of wet wipes. A little bit like when we were in the pandemic, putting on our alcoholic gel on our hands and then eating a sandwich. But we knew that that wasn't really what the food tastes like. A baby's first experience, if that's what is happening, the food can often taste a little bit horrible, like those wet wipes. So please, 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 even if you're a little bit anxious around mess, wait until the mealtime is over before cleaning up your baby. Okay, the vegetarian and vegan diets. You may wish to choose a vegetarian or a vegan diet, and I would signpost you to First Steps Nutrition. It's a really useful website. It contains practical advice and recipes of portion sizes, milk alternatives, and lots of vegan recipes and additional information to make sure your baby is getting the nutritional needs that they require. Portion sizes. Your baby's tummy is really small. It's the size of their fist. So that's really, really tiny. So it's going to get full quite quick. Look at their cues of when they're full and when they're hungry. When they're hungry, they may lean towards you, open their mouth, reach their hands towards you to grab the food from you. When they're full, they might clamp their mouth closed, turn their head, push the spoon away. That is perfectly normal and it's their way of communicating with you, and it's really important as a parent to respect their cues. When they say they're full, please don't continue to force them to eat the food. Take it away. They are full. And it's about trying new foods and flavours rather than the amount that they actually eat, because remember, they are still on their milk. Okay, so drinks. We've mentioned previously about drinking out of a cup with 2 handles at each meal time. Squashes and juices contain lots of sugar, so they're not suitable for your baby. Babies can drink water. They can drink water straight from the tap from 6 months. There's no need to boil or cool it down. No need to boil it and cool it down. They can have it straight from the tap. If you're a little reluctant to drink your own tap water, it may be an idea that you do boil it down. We don't recommend bottled water because they contain high levels of sodium and sulfate. So foods to avoid. Honey, we wait until they're 12 months old because this is linked to something called infant botulism, which can make your baby a little bit poorly. Shellfish can increase the risk of poisoning. Whole nuts because of the risk of choking. Shark, swordfish, marling, rice milk and unpasteurised foods. We also don't recommend adding sugar to your foods. If baby has a Weetabix, we would recommend not covering it with sugar. Your baby doesn't need extra sugar. It's going to sit on those teeth and rot those beautiful new teeth away. And baby also doesn't need added salt. This is no good for baby's kidneys. They can't cope with too much added salt. So please be mindful when you're buying gravy and things like that. Have a little look at the salt content. You can get low salt products. Also, when you are boiling your carrots or potatoes or whatever it may be, if you like salt in your food, take babies out before you add the salt. Baby does not need added salt. Okay, so allergies, what to look for: breathing difficulties, runny nose, stomach upset, and skin reaction. If you're concerned, contact your GP or contact 111. Always keep a food diary that's recommended. Write down what baby had and what allergy that they may have had. Unfortunately, you don't know whether your baby is allergic to something until you try it a couple of times. For example, if baby eats a strawberry, has a rash on their face, we don't know whether that is teething rash or it could be the strawberry. So make a note of it. Next time you give baby strawberry, if the same reaction happens again, it could be they're allergic to that strawberry. And keep a diary of it. Contact 111 or your GP if you have concerns. If your baby has a severe reaction, 999. Okay, so safety. Always stay with your baby when eating and make sure they're upright in that high chair. Okay, remember to use soft battens of food, avoid hard ones. So always parboil. If you're introducing apple to your baby, peel it, core it, boil it to start with, then wait till it's nice and soft. Rather than giving them a hard apple straight away, they can have a soft apple or a soft pear. Avoid bones, and small round foods such as grapes and cherries need to be cut. And you can peel foods such as sausages if you're concerned about the choking as well. We've just said about avoiding nuts, but they can have peanut butter smooth, so long as you know there is no allergies. If you notice any allergies, please make a note of it and contact your GP. You can thoroughly wash your bowls and spoons in hot soapy water, the same as you would your plates and forks. Bottles and teats still have to be sterilised for as long as they are used. It may be worth looking at first aid apps on your phone as well, so that you know what to do if there is a problem, if baby does start to choke or gag. Okay, so vitamins. Breastfed babies should be on 10 micrograms of vitamin D daily from birth. This is switched to a multivitamin supplement at 6 months old. Babies that are formula fed, all their vitamins are in the formula until their formula dips below 500 millilitres, that's 17 ounces or a pint of formula. And then we advise to introduce a multivitamin supplement. Okay, breastfeeding and returning back to work. You can continue breastfeeding if you are returning to work or to study. This helps to keep that close relationship with you and your baby and provides extra comfort and security for as long as you wish. You don't need to stop breastfeeding. You can try choosing childcare close to your work stroke study to feed before, after or during break times. Breastfeed at home, then express for when you are at work or study. Try to express into a cup or a free flowing beaker or a bottle, depending on the age, before you return. Let your employer or course provider know so that they can discuss this. And for more information, there is a website, maternityaction.org.uk, for further advice. If you need any advice on hand expression or pump expression, please contact your health visiting team. Okay, so oral health. Brush your baby's teeth as soon as they are fully through. When they are gums, please don't brush them because this will make the teeth sore. Use a baby toothbrush with a tiny smear of age-appropriate fluoride toothpaste, and we recommend visiting the dentist around the first birthday, just so that it's a positive experience the first time they go and gets them used to that environment. So this is an exciting journey for you and your baby, so you must try and relax and enjoy the process. Your health visiting team are there to take any phone calls if you need any reassurance or any support. And there is also a YouTube clip with this presentation on to re-look at South Warwickshire Foundation introducing solids. Okay, every month we do run these sessions with families, so if you would like to be part of one of those sessions, please ask your health visiting team and you can book on. You can phone us and we can book you on, or if you have the sticker on your red book or the leaflet, you can scan the QR code and that will take you to a form to complete, and then a nursery nurse will be in touch to sign you on to the next session. Okay, here are some useful websites that we would recommend for further support and advice with introducing solid foods and allergies, and first aid apps as well. And your health visiting team are always there for you. Okay, so thank you for listening today. And any questions, please contact your health visitor team for any further support. Okay, thank you.